Alright, now we're going to start the topic of bones and skeletal tissue. First of all, the skeleton can be divided into two sections, the axial skeleton and the appendicular skeleton. The axial skeleton is the part of the skeleton in the midline. It includes the bones of the skull, the vertebral column, the rib cage. The appendicular skeleton includes the bones of the extremities, so it'd be the shoulder, the arms, the pelvis, and the legs, the bones in those regions. Functions of the skeletal system. 7 main functions of the skeletal system listed here. The first function is support. The bones provide the support that all the body parts are attached to. The muscles are attached to the bone, the organs are attached to the bones. The bones act as framework for the rest of the body to be upright and together. Bones provide protection for the brain, the spinal cord, the vital organs. The skull provides protection for the brain. The vertebral column provides protection for the spinal cord. The rib cage provides protection for the lungs and the heart. Bones provide for movement. Bones act as leverage, and the muscles act on the bones to provide movement for the extremities. Bones serve as a storage factor for minerals and growth hormones. And also the bone is a site of blood cell formation. Blood cells are formed within the marrow of bones. Bones are a place where fat is stored. And also certain hormones are produced by the bones. One in particular, osteocalcin, is a hormone that regulates insulin secretion and glucose homeostasis. That's produced in the bones. Bones can be classified according to their shape. Their shapes are long bones, short bones, flat bones, and irregular bones. The definition of a long bone is a bone that's longer than they are wide. And basically all the bones of the limbs, except for the patella, which is the kneecap, the bones of the wrist, and the bones of the ankle, are considered long bones. If you notice, the femur, for example, is a long bone. But so are the bones of the individual finger bones. Even though there's a difference between the size of the finger bones and the femur, they both are longer than they are wide, so they both meet the criteria for a long bone. Short bones are cube-shaped bones. These are found in the wrist and the ankle. It also includes sesamoid bones, which are bones that form within tendons. The largest sesamoid bone is the patella, or the kneecap. It's formed within the quadriceps tendon. Flat bones or flat bones. They're thin, flat, slightly curved bones. This will include the bones of the sternum or the breastplate, the scapula, shoulder blade, the ribs, and most of the skull bones. These are all flat bones. And what's left over are the irregular bones. These are bones that are complicated shapes, such as the vertebral bodies, or the hip, pelvis bones, coxal bones, or the bones of the bones of the pelvis. Coxal, you remember, means hip, so this would be the hip socket bones. Now we're going to look at the features of a long bone. Again, this is the long bone. We're talking about longer than they are wide. So this would be anything from as large as the femur down to the bones of the distal phalanx, which is the distal bone in the little finger. The diaphysis of the bone is the shaft of the bone. Within the inside of the bone, there's a medullary cavity or a marrow cavity. This is the space inside the bone where bone marrow manufactures blood cells. Periosteum is a fiber sheath surrounding the bone. Just be aware that the periosteum is full of nerves, and when you fracture a bone, it's the periosteum that causes the pain because there's so many nerves in the periosteum. Now, we said the shaft of the bone is the diaphysis of the bone. The epiphysis of the bone are the ends of the bone. Their ends of the bones are enlarged compared to the center of the bone. And a long bone, the ends of both ends, superior end and the inferior end, are both have an enlargement compared to the middle or the diaphysis of the bone. These large areas here are where the bones articulate with other bones, or where muscles are attached to the bones. Within the periosteum of the bone, there's a small hole that allows blood access to the bone. This is called the nutrient foramina. A foramina or foramen is a hole or an opening in the bone, usually for a blood vessel to go through. The bones also have an articular cartilage. This is a layer of hyaline cartilage that covers the joint surface. This makes a smoother surface for the bones, so that when a bone articulates with another bone, this articular cartilage acts as a smoother surface to allow for ease of movement. The periosteum was a membrane surrounding the bone. Outside the bone, the endosteum is membrane surrounding the inside of the bone, or surrounding the marrow cavity. That's the endosteum. Endo, think of inside, and osteum, endosteum. Whereas periosteum peri means around, that goes around the bone. The epiphyseal plate, we see here, that's a growth area. It's an area of hyaline cartilage that separates the epiphysis from the diaphysis. Remember, the epiphysis is the end, the diaphysis is the shaft. This allows for bone growth during childhood. Now, we've talked about bony matrix when we talked about connective tissue. Matrix, remember, is the stuff between the cells of a connective tissue, and bone is a connective tissue. So this is in between the bone cells. There's stuff, and this stuff is called bone matrix. In the bone, it's 25% water, about 25% protein or organic matrix. 50% of it is a hydroxyapatite, of which is made of calcium and phosphate and other minerals. And when it's first made by the bone cells, it's soft, it's movable, but then as it matures, it becomes very rigid and very strong. That's what gives the bones their hard nature and the hard characteristic. Now, the bones have cells within the bones. Just like with any connective tissue, cells are part of the connective tissue. We'll look at the cells that are involved with bones. First one is osteogenic cells. Osteogenic. The name osteo means bone. Genic is genesis or creation, to bone creating cells. These are stem cells that are located in the periosteum and the endosteum region. And they're mitotically active. That means they undergo mitosis to reproduce themselves. These stem cells are undifferentiated, but then they can differentiate into bone cells. So when these cells divide, they differentiate into osteoblasts. They differentiate into bone lining cells, or they can remain as osteogenic cells. Osteoblasts. This should sound familiar. We talked about osteoblasts when we talked about connective tissue, the cells of connective tissue. Remember, blast cells are the immature form of the cells that secrete the matrix. So osteoblast cells are bone-forming cells. They secrete an unmineralized bony matrix. So they secrete what would later become the hard substance of the bone. It's a matrix including collagen and calcium-binding proteins. These cells are highly mitotic, so they're reproduced by mitosis. Remember, osteoblasts build the bones. They form the bones. Osteocytes. We talked about osteocytes before. When we talked about, remember the cytes cells? These are mature bone cells that monitor and maintain the mineralized bone matrix. They live in tiny cavities called lacunae. They have long finger-like projections that reach into the caniculi to connect with other osteocytes. They sit stress to the bone and communicate to the bone cells and undergo bone remodeling. If they die, the bones matrix surrounding them is reabsorbed. So the osteoblasts are the immature form of the cell that secrete the bone matrix. Once the bone matrix has been secreted, then those osteoblasts get caught up in the osteomatrix, in the bone matrix, and they become osteocytes. So you have a progression from osteoprogenitor cells or osteogenic cells, which develop into osteoblast cells, which then release the matrix of the bone cell, or release the matrix of the bone tissue. Then the osteoblast cell changes into osteocyte cell once it gets surrounded by the matrix. Then its job is to maintain the matrix. Bone lining cells. These are cells on the surfaces of the bone. This could be the periosteal surface or the endosteal surface. Periosteal cells line the external bone surface. Endosteal cells line the internal bone surface. Osteoclasts are another type of cells found in the bones. These are not from the same source as osteogenic cells, osteoblast cells, osteocyte cells. These develop from hematopoietic stem cells. Hematopoietic means the stem cells that produce the blood. So these come from the cells that produce blood, specifically the macrophages, which is a form of white blood cell. So it says here that these are derived from hematopoietic stem cells that are from macrophages rather than from osteogenic stem cells. So this comes from a different line, there's a different family of cells. These are giant multinucleate cells that resorb bone. So you have this interplay between cells that build bone and cells that resorb bone. This just gives a summary of these cells. I'll repeat: the osteogenic cells are the stem cell and the inner layer of the periosteum that give rise to osteoblast. Osteoblasts are bone-forming cells. They become osteocytes, which are mature bone cells. Osteoclasts, which comes from a whole different lineage than these other three. These are bone-destroying cells. They break down the bone matrix for remodeling and release of calcium. Osteoclasts come from the hematopoietic stem cell line. Bone remodeling is a process executed by both osteoblasts and osteoclasts. Bone remodeling is just reshaping of the bone, and it involves building up bone and tearing down bone, especially rebuilding and remodeling the bone. Here's a memory tool to help you remember. Osteoblast builds bone, osteoclast consumes bone. Using the example of a long bone, we'll look at the different types of bone. There's compact bone and there's spongy bone. Compact bone is seen in this long bone here is forming the outer layer. The dense bone is smooth, it's solid. The spongy bone, which is also called cancellous bone or trabecular bone, has a honeycomb appearance. It's called spongy bone because it looks like a sponge, not because it feels like a sponge, because this bone is very hard, it's very firm, it's not soft like a sponge, it's not squeezable like a sponge, but it just has openings and pores to make it look like a bone, make it look like a sponge. Therefore it's called spongy bone. We remember when we talked about histology, we talked about the bone histology. We looked at the rings of the bone, look like tree rings. This is bone tissue or osseous tissue. We'll look see what these rings, what forms these rings. These rings are the osteons, that is the structural unit of compact bone. Here's an individual ring seen from a different viewpoint. See, there's different layers of bone with fibers going in different directions to add strength. See, this fiber runs at 90 degrees compared to this fiber. This fiber runs at 90 degrees compared to this layer, and this alternating layers of direction of collagen fibers adds to strengthen the bone. It withstands stress and will resist twisting, and that's what gives it an onion appearance. Each of these layers look like layers of an onion when you look at it from a cross-sectional view. Here's a picture of the same thing looking from a different angle. Here's the osteon here. Here's a picture of the different osteons. All the circular, tubular structures are osteons. They're combined together. Some other features here we look at. There's in the middle of the osteon, there's a central canal. Here shows the central canal here. It contains a nerve, a vein, and an artery run through the center of the osteon. Central canal here. The layers of bone that form the tree trunk rings are called lamella. See the lamella here. Lacunae are basically areas within the bone where osteocytes live. This is where the osteocytes, when they were osteoblasts, they secreted this bone matrix and it surrounded the bone, and then the bones become lacunae, and that's where houses the osteocyte cells. Here's a picture of a lacunae with the osteocyte inside the lacuna. Just note that there's a central canal running through the osteon. There's perforating canals which run at 90 degrees and connect one osteon to the next osteon. Perforating canals. This is going to illustrate some of the same things. You could read this. Just be familiar with osteons and the central canal and the caniculi that contains blood vessels and nerve fibers. Just be familiar with the basic structure of the bone and how the bone is organized and laid out. This is just information I've already told you, but it's also included in the slides with these bullet points outlined in blue. There's two different types of lamella. Lamella is basically layers of bone. There's a circumferential lamella, which provide the circular structures, and the bone in between the circular structures are called interstitial lamella. Interstitial lamella. This fills the gaps between the forming osteons. There's two ways that bone is formed. One is called endochondral ossification and intramembranous ossification. The term ossification basically means bone development or bone production. Endochondral ossification is what forms most of the bones below the base of the skull, except for the clavicles or collarbones. It basically starts out as hyaline cartilage. The hyaline cartilage must be broken down before it can be replaced by bone. But the hyaline cartilage acts as a template that later becomes bone. That's why it's called endochondral ossification. The name endochondral means within the cartilage. It's hyaline cartilage, so the chondral has to do with means cartilage. So this would imply this is bone formation that comes out of cartilage, endochondral ossification. And basically this is all the bones inferior to the base of the skull except for the clavicles. The other type of ossification is intramembranous bone. This forms flat bones of the cranium of the skull. Just like a membrane is usually a flat surface, the intramembranous ossification forms flat bones. You need to know what Wolff's law is and what its effect is on bones. Basically, Wolff's law says that a bone grows and remodels in response to the stresses placed upon the bone. By stresses, I'm referring to the forces applied to the bone due to the weight of the body pressing down or the pull of muscles on the bones. So the forces and weight and stresses applied to the bone is what really shapes the bone and what causes the bone to have its unique shape. This just illustrates some of the responses of bones to Wolff's law. Bones reflect the stresses they encounter. Think of this bone here. This is the femur. The weight of the body is transmitted through the hip joint here. So this part of the bone is going to be reinforced and bone added to this to give it strength to withstand the weight of the body. It's going to resist compression forces here and distraction forces here. Some examples of Wolff's law would be somebody's right or left-handed has thicker and stronger bones in the dominant upper extremity. Curved bones are thickest where there's bones are most likely to buckle. Large bony projections occur where heavy active muscles attach. The bones of a fetus and of a chronically bedridden person have no features because they don't have stress or force applied to the bones. Remember, the stress and the force to the bones is what gives the bones its shape and the features to the bone. I want to use the example of dental braces to illustrate Wolff's law and bone remodeling. Bone remodeling is a balance between bone buildup and bone breakdown. So here you have a tooth with an appliance for braces to remove the tooth. So this person has braces and the point of the braces is to move the tooth to have a straight teeth and to straighten up crooked teeth. So the direction that you want this tooth to go is from left to right. And so you have these osteoblasts, osteoclasts. So there's pressure moving the tooth to the right. So that's going to leave a sort of a vacancy there. It's going to leave a place here where there's I guess its forces would result in a somewhat lack of bone here because the tooth's being pulled in the direction away from the bone. So osteoblasts would fill in the space. Remember, osteoblasts build bone. So osteoblasts would fill in the space with bone, new bones. And since this area is under compression, this is the direction the tooth is going in this direction, osteoclasts come in and break down the bone. It resorbs the bone. So through the process of resorbing the bone here and laying down bone here, you basically have a movement. It allows movement of the tooth in the direction from left to right. And that's basically how bones remodel based on the structures and the forces applied to the bone. Now we'll look at bone fractures, the different types of bone fractures, the different categories of fractures, and we'll discuss that. First of all, a fracture can be either non-displaced or displaced. A non-displaced, such as this one here, means the ends of the bone remain in their normal position. It's often easy to miss a non-displaced fracture on X-ray because there's no obvious fracture. There's maybe a hairline fracture or a fracture where the bone is not displaced, so you don't see the bones. It's not an obvious fracture, as opposed to this displaced fracture when the ends are out of alignment. It's easy to see what the fracture is here. That's a displaced fracture. That's of the radius. There may actually be a fracture here of the ulna. You see there's a little bone shadow here. That may represent some soft tissue injury. So this may be a partial fracture to the ulna, but not a complete fracture. Certainly not a displaced fracture of the ulna, but there is a displaced fracture of the radius here. Fractures can be classified as either complete or incomplete. A complete fracture is broken all the way through. An incomplete fracture is partially broken. So here's an example of a complete radius and ulnar fracture. That's a pretty bad fracture. This is an example of an incomplete fracture where it's only half of the bone is broken. It's not completely broken. It's an incomplete fracture. You see this edge of the bone, the left edge of the bone for both sides is intact. The right edge of the bone is fractured. A bone fracture can be either open or closed. Open means the skin is penetrated. Closed means the skin is not penetrated. Here's an open fracture. You can see the bone through a wound. The closed fracture, like this distal radius fracture, is closed. There's no bone sticking out, but there's obviously a displacement here. You can see there's obviously a fracture here by the alignment of the wrist and the hand. So you know there's a fracture there, but it's closed, meaning there's no open areas of the skin. One thing you need to be careful about with open fractures is once the skin is penetrated, there's risk for infection. There's a few more types of bone fractures. Comminuted fractures. Basically, the definition of a comminuted fracture is there's 3 or more pieces of fractured bone fragments. This is common in the aged population whose bones are more brittle. There's a compression fracture, which is seen primarily in the vertebral bodies. The bone is crushed. Like here's an example of a vertebral, crushed vertebra. If you compare this normal vertebra here, it's more box shaped. This one appears to be crushed and squunched down. Called a compression fracture. A spiral fracture. This is a spiral fracture seen in an injury where there's twisting forces. This is commonly seen in sports injuries, where maybe the football player plants his foot down and then twists his body, and results in the twist results in a fracture of the, in this case it looks like a tibial fracture, but it results in a spiral shaped fracture. There's a physeal fracture, which is a fracture through the physeal plate. Now this becomes a problem because this can interfere with growth. Remember, up until the age of puberty, the physeal plates are there to allow for the bone to grow. If the physeal plate is injured through a fracture, it can disrupt the normal growth process and can result in the abnormalities of growth of the bone. A depressed fracture is seen in a skull fracture. It's a result of a broken bone portion pressed inside. It's inward press. It's depressed. It has a depressed area. A green stick fracture is common in children. It's basically an incomplete fracture in which only one side of the shaft breaks. It's called green stick because it's like how if you bend a green twig, it typically doesn't break in two like a dry stick would, but since it's green, it's more flexible. It may break only halfway, and that's kind of what you have here. You have the bone fracture was bent and it breaks the outside edge but not the inner edge. See, it only breaks halfway through. This is common in children. Once you have fracture, there's ways to treat the fracture. First of all, you need to reduce the fracture and you need to immobilize the fracture. Reduction is basically realignment of the broken ends of the bone. It could be a closed reduction or an open reduction. Closed reduction means the bone is manipulated into the correct position without surgery. Open reduction means surgery is involved to open it up, to put in pins or screws or wires to secure the ends. Immobilization is once you've got the bone reduced and the ends are back together, you need to mobilize the fracture. Now that can be done either by an external cast to the arm or by screws and pins inside the bone. Here's an example of internal fixation using screws and pins to a hip fracture. Here's an example of external fixation just through a cast for a broken wrist. The stages of bone repair. It starts with a hematoma form. So the bone is fractured. First of all, there's blood. The bone is very vascular, so there's blood that's going to leak around here. It's going to form a hematoma. It's going to cause a swollen area, bulging area outside of the fracture site. It's full of blood. It's very painful. It's swollen. It's inflamed. A hematoma clot forms, and then after that, inflammation occurs and the bone starts to repair itself. The second stage involves the development of a soft callus or fibrocartilaginous callus. Capillaries grow within the hematoma. Phagocytic cells clear out the debris. Fibroblasts secrete collagen fibers to kind of span the break and try to reinforce the broken area. Cartilage cells reconstruct the cartilage. Osteoblasts reconstruct the bone. So you have a crew of different bone and cartilage repair cells coming in to try to fill in the gap and repair the broken areas of the bone. And it starts out as a soft fibrocartilaginous callus. Then that turns into a bony callus as the soft callus hardens This process may take 6 to 8 weeks. And finally, bone remodeling occurs. Once the bony callus has been established, then the normal stresses of the bone can then reshape the bone like it originally did when the bone was first formed, and this results in a restoration of the normal shape of the bone. The final structure resembles the original structure because it responds to the same mechanical stressors that the original bone was formed under. The bone remodeling stage can occur for several months after the fracture. So you might wear the cast for 6 weeks, but the bone remodeling may occur for several months after the fracture occurs. Bone markings refers to the different projections or depressions on a bone. A projection on a bone is basically an outward process of a bone, or a place where the bone sticks out. This is created by muscle pull or joint or press of joints. This is opposed to a depression or an opening in the bone, which is a place where nerves or blood vessels pass through the bone, or maybe for pressure for overlying muscles. So it's like have mountains or valleys. The bone may have a mountain or an outcrop in the bone, or may have a valley, which is depression. Here's a list of projections. Notice on this, like on this picture, this shows some projections. There's the in the femur, there's the lesser trochanter and the greater trochanter. These are projections that are formed by the pull of muscles pulling on this bone, so it creates an outcropping of bone in that direction. Or on distal ends, these enlarged ends are a result of pull of ligaments and tendons on this part of the bone. All these are different projections of bone. Tuberosities are seen actually in the humerus, so it's similar to a trochanter. It's just an outcropping of bone. A crest, that's like an iliac crest, is an outcropping of bone. A trochanter is seen here in the femur trochanter. A line, those areas of the bone that has a ridge called a line. Tubercle. Epicondyle, that's an epicondyle here. It's just a place where ligaments can pull out a process on the bone. Again, this is bone formation. It occurs from the result of stresses and pressures applied to the bone. A spine. This is seen in the scapula. There's an outcropping of bone called the spine of the scapula. We'll see that in a later lecture. Or process. These are all names for projections of the bone, or if I use the word mountain as opposed to valley, there are areas where there's bone buildup, as opposed to these are depressions or openings in the bone. A groove, a fissure, a foramen. Remember we talked about foramen? There's a area where a hole through the bone for blood vessels run through. You have a notch. A meatus is a hole through the bone. Sinus is a hollow space in the bone. A fossa is an area of the bone that is a space that's carved out to make room for muscle or for soft tissue. So all these are different depressions that are found in bones.